I recognize the honourable member for Richmond.
Thank you, Mr. Chair. When the Honourable Minister stood to say he was happy to see young people here in the legislature, I thought he may have been referring to myself and some of my colleagues, but he was talking about much younger people here in the gallery. But I certainly want to extend my welcome as well to 596 Phoenix Squadron, and certainly commend their leaders and chaperones for bringing you to the legislature here today. Just briefly, no, I'm sure this is a chance for them to see democracy in action, and just to give them a brief understanding of what we're doing right now is that the government, which sits over on that side, we're the opposition, the Liberal caucus here, and that is the Conservative caucus just over to my left. The government has brought in a budget. What we now do as members of the opposition is that it's our opportunity to question the government on their budget and on some of the spending priorities and some of the concerns that we may have, both locally and provincially. And right now we have the Honourable Minister of Health who is here to discuss her budget, which is the single largest budget of the government that's being presented. I don't have the total figure in front of me, but it's, I believe, almost $4 billion. Which is a significant amount of money, to say the least. And the minister has her deputy with her, and I believe one of her finance representatives as well, who are here to assist her in answering some of our questions. So I will take a few minutes now to raise some concerns. I represent Richmond County, which is on Cape Breton Island, and I will take the opportunity just to ask a few questions about some local issues. And Minister, I know you've been at this for a while now. I will do my best to be brief in my questions, and I would certainly appreciate as much as possible if you could be brief in your answers so that I can get some of the issues that are of concern locally, and which doesn't eat up too much time from my colleagues who I know have a number of questions as well. Minister, you'd be, as you're well aware, St. Anne's Community Nursing Care Centre was one of the sites identified in the Ross report as, I believe it's the care model, I believe is what it's being defined as. As you know, that has caused great concern in our area because of the fact that, if I'm not mistaken, and I've given these numbers to the Minister before, I believe the St. Anne's Centre emergency room in the last 15 years has been closed for 10 days. So it is not a chronic problem that has been identified in other communities, and I can tell you residents of Ville-Madame, Louisdale and surrounding areas can see Dr. McNeil on Monday morning if they need to see Dr. McNeil on Monday morning. So the idea that chronic closures of emergency rooms plus not being able to see your doctor, family doctor in a timely fashion is not a problem in our area. So I guess the message that the board has given, that the community has given, that the local doctors have given is that it's not broken. It is working in our community, and we're not sure why monies would be expended to try to fix a problem that doesn't exist. So I know in the budget you've identified Parsborough as one of the sites that would be under this model. I believe it's already in place, but you've also indicated, I believe, there's at least 3 more sites that are planned for this fiscal year. We don't know what those 3 sites are, at least I don't know. So on behalf of the community, the board and the local physicians, could you advise us what the intention is of the department in regards to St. Anne's and the conclusions drawn by the Ross report?
I recognize the Minister of Health.
Thank you very much, Mr. Chair, and I too would like to welcome our guests in the gallery. The question that has been asked with respect to St. Anne's is a very good one. And I want to assure the honourable member that I have no intention of fiddling in something that's working. If it's working, then I have plenty of things that aren't working that need my attention, and that's where my attention is going to go. It's not going to be diverted into solving problems that don't exist. I do want to say to the member that I feel badly that I haven't gotten around to visiting St. Anne's. And it's definitely on my list, and we're trying very hard to find a time this spring to go for a visit. Not to be the bearer of bad news, but to, just inform myself of this, of the services of this centre. And I say this because Dr. Ross spoke very highly of this particular centre. He impressed on me, I think, the uniqueness of that centre. He was actually very complimentary of a number of healthcare facilities on Cape Breton Island, including what they're doing in the community of Cheticamp. But I have always wanted to go to the St. Anne's Centre, and it wouldn't be that far a visit from where my parents live in some ways, and I've been spending a fair amount of time over the last little while because of my father's illness. I go fairly frequently to that area, but it's hard, I find, sometimes to fit in a business visit and a family visit, and so it just hasn't come together. But it is my plan, and I think we've identified a potential date sometime later in the late spring or early summer, and but I do want to reassure the member that the other CECs that we'll be announcing this year, that will not be one of them. We're really very much focused on those communities where people are having a difficult time getting access to a family doctor or other healthcare provider, where the waits are long, where then the traffic is into emergency rooms, and putting a burden on those healthcare facilities that are hard to cope with. And it's not to say that at some point in the future we won't have to look at a CEC in that community, but it's certainly not something that is going to happen anytime soon.
I recognize the honourable member for Richmond.
Well, thank you, Madam Minister. And needless to say, I'm sure that both the board, staff, and the doctors and the community will be pleased to hear that answer. And I can tell you, and I know that the minister's family doesn't live too far from Cape Breton, but you are on the mainland, so I do want to point out that, and I'm sure the deputy would recognize that in Cape Breton, showing up at the last minute or showing up unannounced is never frowned upon. So don't hesitate that if you do have time in your schedule, even if it's a couple of hours. I know that the board and the staff and the local doctors will certainly do everything to accommodate the minister in a on very short notice, because I commend the minister for a statement, because sitting in an office here in Halifax and hearing what St. Anne offers truly doesn't give you an appreciation until you walk through the facility. You see the diabetic clinic, you see all of the services that are being offered, and I know there's more collaboration taking place now with GASHA. The fact that they are still a standalone entity, not under a district health authority, there is those services being provided. There is a great relationship, and ironically, after years of doctor shortages, we're actually looking right now at a number of medical students who have already indicated that they are coming to our area. One has already been signed starting September, and there's at least 2 or 3 more that are ready to come. So for us, we're in the best situation we've been in a long time, and so having that stability at St. Anne Centre is a significant part of that recruitment effort, and I'm certainly pleased to hear that there will not be any changes this fiscal year. And I would again encourage the minister, once she sees the facility, hopefully will conclude that there is no need to make any changes at St. Anne's, because it clearly is working well. The community is very supportive of it, and the amount of extra services that are being provided both in education and in support for various ailments and diseases is truly incredible. I also wanted to raise with the minister one of our other proposed health facilities, which would be the Dr. W.B. Kingston Memorial Health Clinic. The minister knows I've raised this in the House before. She's received correspondence from the organization. Right now, this group has been working on this for a number of years, and the previous government